Hello, thank you for taking a moment of your valuable time to explore your persistent pain prior to seeing your healthcare professional. My name is Tom and I am a clinical specialist physiotherapist with an interest in ongoing persistent pain. Ongoing persistent pain needs to be treated differently to acute pain caused by an injury. The latest research now shows that the more we understand about our pain and what causes it to persist, the more we can gain control over it. Remember, if we've always done what we've always done, we'll always get what we've always got. In order to start getting different results, we need to make a change. This information video has been put together to provide you with an understanding of the difference between acute pain and ongoing pain, and what can be done to help ongoing pain based on the latest evidence and guidelines. Experts agree that pain is a universal human experience and is very common, with persistent pain lasting for longer than 3 months, affecting 1/3 of the UK population to some extent. But have you ever thought of what pain actually is? Most people will describe pain with such words as in the picture below. The world-leading Pain Association describes pain as an unpleasant sensory and emotional experience arising from actual or potential tissue damage that is always real and is unique for each and every one of us. Pain is 100% produced by our brain, and our brain produces an output in the form of pain if it thinks protection is required from an actual, potential, or perceived threat. We know that our brain, rather than our limbs, is responsible for producing pain because people can experience pain in a limb even when a limb has been amputated, for example, phantom limb pain. If you didn't have a brain, you wouldn't have pain. You may have a good understanding of what acute pain is. Acute pain is when your body has experienced actual tissue damage or an injury. For example, you may have bent forward quickly and sprained a muscle in your lower back, or fallen and broken a bone in your arm. This results in disruption to the tissue, causing an inflammatory response. Research shows that receptors in and around the injured area become active. These receptors respond to mechanical or pressure changes, chemical and thermal changes, and send signals through your central nervous system via your spinal cord to your brain. Your brain interprets this information, often subconsciously, and produces an action that it thinks will ultimately protect you. In the case of a sprained muscle, you will likely move stiffly and not be able to move as much. This is your body's way of offloading certain body parts to allow new tissue to be laid down, repairing the injured area. In this scenario, pain is an alert signal to prevent excess load through the affected area. Acute pain is very useful for us. In this scenario, pain is a protective mechanism, giving the body time to heal. Research shows that this healing process takes no longer than 3 months, no matter what sort of tissue or where in the body it is. If you imagine your nervous system as a volume control on a car radio, in acute pain, the volume control has temporarily been turned up. Acute pain is short-term. It reduces with steady exposure to movement and load. You will start to be able to move more efficiently, your strength increases, and you will return back to pre-injury function. However, we know that people can experience pain for longer than 3 months. This is known as persistent pain, and we know that this is not useful like acute pain. In fact, it is highly annoying, has a significant impact on our life, and holds us back from everyday activities. It is likely, as you are watching this video, that you have experienced or are currently experiencing ongoing pain. Pain that has continued for over 3 months does not indicate ongoing damage, yet pain is still experienced. Pain is not an accurate measure of tissue health. Take a paper cut, for example. The area of tissue damage is extremely small, but blimey, how much can it hurt? Or if you stand on a piece of Lego, you are very unlikely to have injured tissue at all, but I'm sure you're cursing the person who left it there. As mentioned earlier, our brain produces pain if it feels that protection is required. Sometimes our brain can be overprotective or hypervigilant, producing unnecessary alert signals. You can have pain without any physical stimuli with such things as memories, emotions, thoughts and places, all being scientifically proven to activate alert signals. Modern pain science has demonstrated that how we think and how we feel about pain changes how it behaves. Understanding your pain is important, as it can change how things hurt. Understanding your pain is important, as it can change how much things hurt. Imagine our nervous system being like a car alarm, something that wishes to protect us. If a burglar is breaking through the window and stealing your best Kylie Minogue CD, you want that burglar alarm to go off, right? This is like acute tissue damage, when you twist awkwardly and strain a muscle in your back. The response of the alarm is appropriate for the input. This is protective. However, car alarm systems can occasionally go off when a cat jumps on the bonnet, or even if it gets too cold. Your Kylie Minogue CD is safe, but the car alarm is still blaring and annoying the whole street nevertheless. This is more like what happens in your central nervous system when you have ongoing pain. The reaction of the central nervous system is disproportionate to the event that has triggered it. Another way of thinking about it is that you are walking along a stage, blindfolded. At the far end of the stage, 15 metres away, is a 3-metre drop. You don't want to go near the end of the stage for fear of falling off and hurting yourself. You would want someone to intervene to prevent you from walking too close towards the drop. In this analogy, this person would be your nervous system. If you had a hypersensitive nervous system that was highly aware of the potential of threat, you would have been stopped only having walked 2 to 3 foot, nowhere near the end of the stage and potential harm. This is like your body only allowing you to minimally turn your head if muscle spasm is present in your neck. If your nervous system was not as hyper-aware, you would be able to walk really close to the edge of the stage, or in other words, be able to look over your shoulder. In a real-life application, the less hypersensitive your pain system, the more you would be able to do. You would be able to do more of what you enjoy, and thus your quality of life would likely improve. You would be able to interact with your loved ones more, walk to the local park, or undertake a Pilates class if you so desired. Another way to say that your nervous system is overactive is to say that it is very sensitive. The volume control on the car radio has been turned up and remains high. Things like too much activity, global muscular tension, sleep difficulties, tense relations, stress, anxiety, and low mood can all lead to the nerve volume increasing. These factors all make the central nervous system more sensitive. Pain is a necessary part of the body's protective system, but should settle with the right treatment. Pain all the time can stop us doing things we enjoy, which has an impact on our mood and well-being. This can then reduce our activity and increase our stress levels, leading to overactivity of a part of the nervous system called the sympathetic nervous system. Our sympathetic nervous system is responsible for increasing our heart rate and breathing rate. You may have heard of our fight or flight response. This is the response of our body when we are under actual or perceived threat, and it causes our bodies to release more of the stress chemical, cortisol. This is known as a stress response. In the short term, this is very useful. Our brain is initiating our body to remove us from danger. However, if the stress response remains active for too long, it increases our nerve sensitivity and can result in poorer quality of sleep and anxiousness. The question is, what's best to do about it? Luckily for us, we know that the nervous system is the most adaptable, moldable system in the body. If it can learn something, then it can unlearn it too. In fact, research shows that central nervous system changes regarding persistent pain are reversible. Our brains like change and challenge. We ultimately need to learn to retrain the brain and our nervous system. This is where our parasympathetic nervous system comes into play. Our parasympathetic nervous system is responsible for reducing our heart rate, lowering our blood pressure, and it makes us feel sleepy. Imagine you've just had a big meal. Most people feel they want to rest and fall asleep. Hence why the phrase rest and digest describes our parasympathetic nervous system. Our body's activity is settling. The stress response is reducing. In order to reduce our nerve sensitivity and turn down our nerve volume, we need to encourage the activation of our parasympathetic nervous system more often. So how do we reduce our nerve sensitivity? How can we gain control of the nerve volume and turn the volume down? We need to encourage our brains to release its own naturally occurring pain-relieving chemicals. We know that our brain has its own medicine cabinet. You may have heard of the terms endorphins, serotonin, or oxytocin. These are the chemicals that are known to reduce the stress response, reduce muscular tension, and reduce nerve sensitivity. Research shows that things like regular, gentle exercise, relaxation, mindfulness, and increase in positive thought patterns can all release these chemicals and reduce pain levels. We turn the volume control down via introducing graded, gentle exercise. This is where physio plays its role, achieving thoughtless, relaxed, fearless movement. We need to reduce stress and increase relaxation via techniques such as mindfulness, yoga, breathing control, and the use of heat. We need to gain regular and restorative sleep, and ultimately learn to take care of ourselves via a well-balanced diet, drinking plenty of water, and maintaining well-being, and have more you time. To change the brain's output, pain, we need to change the input. Making changes is not always easy, but even the smallest of changes can have a big impact. One step at a time. It is a process. We need to prepare, plan, implement, and then review. Hopefully, you now have a better understanding of the difference between acute and ongoing pain, and what can cause pain to persist. I'm sure you have many questions. We often do when we hear new concepts. Please write them down before you see your healthcare professional. Here are some links to further videos in this series and links to websites run by world-renowned experts. Thank you for listening.